anti-PD-L1 inhibitor, Atezolizumab, as first-line treatment for patients with advanced bladder cancer. Please join me in welcoming Dr. Arjun Vasant Balar, Director of Genitourinary Medical Oncology at the NYU Perlmutter Cancer Center in New York. Dr. Balar.
Good morning, everyone, and thanks really for the opportunity to give you some highlights on my talk from earlier today. The focus of this study was to test Atezolizumab, which is an anti-PD-L1 antibody in the first-line setting in patients with cisplatin-ineligible, locally advanced or metastatic urothelial cancer. Wrong direction. Okay, so PD-L1, many in the audience are very familiar, is a negative regulator of the immune system. Atezolizumab is a monoclonal antibody that targets PD-L1, and by inhibiting its interaction with other co-inhibitory receptors, it unleashes the anti-tumor immune response. We focused on a population of patients who have metastatic bladder cancer who are frankly often too sick to receive aggressive chemotherapy, in particular with cisplatin, which is the only treatment that has been actually shown to improve survival in this disease. And so this is why we focused on this disease population. Atezolizumab has been already tested in the second-line setting in this particular trial and is currently FDA approved in the second-line setting. So IMvigor210 study was a multinational single-arm phase 2 trial. What I presented today was cohort 1, which focused on the first-line cisplatin-ineligible patient population. I want to draw your attention to the treatment algorithm here, which was treatment was given at 1,200 milligrams every 3 weeks until investigator-defined progression. Criteria for this population, specific criteria in terms of inclusion for this study, included no prior chemotherapy for metastatic disease, and at least 12 months must have passed since any prior chemotherapy in the perioperative setting, which is around the time of surgery. Cisplatin ineligible meant that patients had to have an impaired kidney function, the definition is there, as well as peripheral neuropathy or hearing loss that was moderate to severe, as well as poor performance status. The primary endpoint of this study was objective response rate. That was centrally confirmed. So here were the data that I presented earlier this morning. In all subjects, the overall response rate was 24%, with 7% of patients achieving what is called a complete response, disappearance of all cancer. When we looked at the subgroups based on PD-L1 expression, which is that protein that we're looking at, we scored subjects based on 0 expression, level 1 expression, and 2-3, which is the highest level expression. What we observed was that responses were seen in all subgroups, including complete responses in all subgroups. And this is at a median follow-up of 14.4 months. 75% of these responses are still ongoing at a median follow-up of 14.4 months. And only 6% of patients stopped treatment due to a side effect. So overall, this therapy was efficacious and also was very well tolerated. Here are the median survival curves. Here what we see is that at a median follow-up of 14.4 months, the median survival is estimated at 14.8 months. The event rate here is 47%, which shows us that these data are actually still immature and much more long-term follow-up will be necessary. And this obviously compares very favorably to historical controls. This is not a comparative trial, so one can't make statements like that. However, this does compare favorably to what we typically use in this setting. So what we observed is that durable responses were observed in all patients with metastatic urothelial cancer in the first-line setting. The objective response rate was 24%. 75% of these responses are still ongoing. The complete response rate was 7%. The median survival was very promising at 14.8 months in yet an immature data set. Therapy was extremely well tolerated with a very low rate of grade 3 and 4 adverse events and low discontinuation rate due to adverse events. And in summary, I believe that these data do make a compelling argument for Atezolizumab to become a potential new standard of care in the first-line setting, and further studies are certainly planned in this population. Thank you.
Thank you, Dr. Balar. This important study demonstrates activity of the anti-PD-L1 antibody in patients with bladder cancer who were not candidates for cisplatin chemotherapy and had very limited treatment options. Many of these patients were elderly, and this study demonstrated that atezolizumab appears to be safe and effective in this patient population.